There was a hearing in September. Senator Ron Johnson was organizing this hearing. And after you said that, what you told me now, there was a Dr. Scott, I think. He says there is a lot of studies, even 1,700, I think, and 661, I think, study. He said that are clinical trials and they are proving safety and efficacy. Then after that, you explaining that he's not right. Can you tell us what was wrong about his statement?
Sure. Dr. Jake Scott, who's an infectious disease professor at Stanford University, prestigious university in the United States, okay, decided that, as he told CNN, a major news outlet here in the U.S., he told them that after he heard Robert F. Kennedy Jr. say that there's never been a routine injected childhood vaccine license based on a placebo-controlled trial, he knew that was false. He knew it, okay? Why? Because he believes, all right? And he set out to prove RFK Jr. wrong, which, by the way, is not how science works, but fine. This is what he decided to do. He reached his conclusion, and then he set out to prove it. And now, all he had to do to know what was relied upon to license each childhood vaccine is go to the FDA website. That's what we do, and get the underlying clinical trial report. Did he do that? No. Instead, he set up a website in which he crowdsourced. Anybody in the world could submit, clinical trials studies that are published. He crowdsourced this list that pointed to this list and he said, see, there are 600 placebo-controlled trials out there for vaccines. And as you heard me respond, I went through all of them. We went through them at my firm, and not a single one of them is a placebo-controlled trial relied upon to license and inject a childhood vaccine in the United States. Not a single one. None of them. First of all, I mean, I laid it out at the hearing, but over 500 of them have nothing to do with those childhood vaccines. Nothing to do with it. Another like 70 of them don't involve children. It's like adults with AIDS. So it's just not extrapolatable. Another 20 or so are not, they claim they're placebos, but they're not. They're an injective of an adjuvant or another vaccine. And it left 3 that actually involved the licensure of a routine injected childhood vaccine. And those 3, when you look carefully at them, also were not placebos. And I went through that in the hearing. So his supposed mountain of evidence is just a smokescreen. He believes nobody's going to actually look at it. Presumably, that's what he believes. And he figures he's just going to throw a list at you and say, here, this proves safety. But how is studying an AIDS vaccine in Africa with HIV-positive folks tell you the safety of giving a Hep A vaccine to a baby? It doesn't. It's nonsense. One has nothing to do with the other. You want to show me that this Hep A vaccine is safe? Give me a study of this vaccine, or at least of a vaccine for Hep A that's the same formulation or similar formulation that's also trialed in children with the placebo. Give me something like that. That's not what he gives you. It's just the list that he's got is nonsensical. I also actually addressed that in the book.
Yeah, and he was very surprised.
He said, I'm very surprised that Mr. Siri has reviewed all 600 trials. He said, because I didn't even review them yet. What an incredible admission. He admits he didn't actually review them. So how's he making a claim? But this is how the belief system works. This is why it's religion.
Yeah. Maybe he admitted because he was under oath. There was a hearing in September. Senator Ron Johnson was organizing this hearing. And after you said that, what you told me now, there was a Dr. Scott, I think. He says there is a lot of studies, even 1,700, I think, and 661, I think, study. He said that are clinical trials and they are proving safety